In this day and age, and indeed for the past 30 years, it is very standard to take the natural lens out and replace it with a plastic lens. Before that time, many surgeons were not putting plastic lenses in the eye to correct the vision. There was a lot of controversy about it, but these days it would be controversial not to put a lens in the eye. We try and put the lenses in to correct the focus at the end of the day so the vision is clear at specific distances. Laser eye surgery doesn't work for cataract surgery, one, because the lens within the eye is cloudy, and laser eye surgery works on the surface of the eye. And secondly, even in lens implant procedures where there's not much cataract, laser eye surgery very often works only at one distance, then you need glasses to correct the other distances. The advantage of having lens implants is that we have the option to try and correct the focus at different distances, as well as clearing the cataract within the eye, which has gone cloudy. Lens implants fall into two main groups. One is single vision lenses and one is multifocal lenses. The single vision lenses act like a single pane of glass, so they focus predominantly at one specific distance. Multifocal lenses, although not constructed like this, do work as if they are multiple panes of glass, like double glazing or triple glazing glass, so they can give you clearer focus at different distances. The advantage of those lenses is that you can have less dependence on spectacles. There are disadvantages of multifocal lenses in that they can give you issues with nighttime vision, such as ghosting, double vision, starburst, halos, and glare. There are other versions of these two groups of lenses. There are what's called toric lenses, which can reduce astigmatism, and they can apply to both single vision and the multifocal lenses. And now we also have extended depth lenses, which again apply to both groups of lenses, the single vision and the multifocal, which increase the range of focusing that's available in those particular groups. Cataract surgery is normally done as a day case, so that you're in and out of the hospital unit on the same day, usually within a few hours. It's done under a local anesthetic in most instances. Occasionally it can be done when you're asleep. The surgery itself takes normally between 15 to 30 minutes, and you lie on an operating table under a microscope, a drape is placed over your face, and the old lens is taken out and a new plastic lens placed within the eye. You go home the same day, and you take eye drops for between 2 to 4 weeks, depending on the surgeon and depending on the type of surgery. The visual recovery, normally between 1 to 7 days, and then you would ordinarily seek any top-up pair of glasses that you needed from your optometrist after 4 to 6 weeks. The risks involved in cataract surgery and lens implant surgery really fall into three main groups. One is the risk of blindness. The risk of you going blind, in other words, having a dreadful bleed in the eye or big problem with the retina, is less than 1 in 15,000 to 18,000. So a very tiny percentage. If that were to happen, that would be a dreadful consequence, and that would be something that everybody, including the surgeon, would be very upset about. So that's a very tiny risk that happens once in a very rare blue moon. The real risks of cataract surgery are problems with the surgery itself, the lens, the surgeon, and all of those things can fall into a bracket of a risk percentage of between 1 to 3%. If those were to happen, then the vision is usually blurred after the surgery, but permanently blurred, so you can't correct it with spectacles or contact lenses. The risk is usually quoted 1 to 3%, but in the most experienced hands is actually, in reality, less than that. The third group of complications which can happen is optical complications, and that is that we don't necessarily achieve the clarity that we want to achieve with a lens implant. And that can be, some of the lenses very rarely can give glare or halos in standard lenses, but again, it depends on the expectations that we have before the surgery. If we expect a specific clarity at a specific distance, it's not always possible to guarantee that. Our lens calculations in surgery are accurate in perhaps 90 to 95% of cases to get on target focus that we want. Say we want a specific distance range that we want to achieve, either distance or computer vision or reading vision. But in some instances, no matter how good the preoperative measurements, no matter how good the calculations and how good the surgery, the end result can be different. And that's because you're trying to put a plastic inanimate object into a soft organ, which is the eye. So it can never be guaranteed that it will focus exactly as it would do, say, perhaps in a machine or a camera or another piece of equipment. This is a surgical process on a biological system, and therefore the final focus can never be guaranteed. Lens implants are said to last about 50 years, which is because they're made of a very inert, stable acrylic material, and that will last all of us for the rest of our lives. The chance of the lens implant moving or being unstable is incredibly small. Some of the lenses, perhaps 5 to 10%, develop a film buildup on the back of the lens because they're held in a capsular bag, and that can go cloudy sometimes within months or years of surgery, but that's very straightforwardly cleared with a laser called a YAG laser capsulotomy in the outpatient clinic.